Thanks everybody for being here today on this beautiful, beautiful sunny January day in Cleveland. We are really delighted that you're here to hear about some of our changes. Over the past year, actually, the board and staff of St. Luke's Foundation has been really working on rethinking our organizational structure and our grant-making processes in order to make them the best that they can be. As part of our analysis, we consulted experts, we talked to some of you in this room, we looked at the literature, we did a lot of studying and a lot of introspection, and we also studied the changing needs in our community. We always try to put the community first and foremost in our deliberations. We studied the broader economic shifts, demographic and societal shifts, and we also evaluated everything that we did in light of these changes. So today we're very proud to share with you what has changed and what has not changed. For those of you who were at our annual meeting or biennial meeting in August, you may recall that I ended the biennial meeting with this quote from Mario Marino's book, Leap of Reason, which has largely influenced our thinking over the last several months as we've been engaged in this process. In his book, Mario said, we need to rethink, redesign, and reinvent the why, what, and how of our work in every arena. We need to reassess where we have the greatest need so that we can apply our limited resources to have the most meaningful impact. We need to be much clearer about our aspirations, more intentional in defining our approaches, more rigorous in gauging our progress, more willing to admit mistakes, more capable of quickly adapting and improving, all with an unrelenting focus and passion for improving lives. And so we at St. Luke's have committed ourselves to rethink, redesign, and reinvent ourselves in the following ways. First, to distinguish those areas where we believe that we have gained real traction. Next, to invest more in the areas where we believe we can move the needle in a positive direction. Third, to invest more in the capacity of our nonprofit partners that are best positioned and capable to do this work. And last but certainly not least, to rigorously document, incorporate, and communicate our continuous learning. This afternoon, we're going to present our new program strategy, our new approach, and some exciting news about staff realignment. Next, Doug Wang, Vice Chair of our Board of Trustees, will discuss how the board was and continues to be involved in this process, as well as some really great news about our spending policy. And then I'll come back and share details on our program strategy areas, something new for us. And then Latita will come and discuss our revised application process. This is the mission of the St. Luke's Foundation, and it has not changed substantively in 15 years. In fact, next month we will be 15. Every word in this mission really has meaning. The first word of significance is reinvest. Historically, the resources of St. Luke's were put into inpatient hospital stays to cure the sick. And today, we are reinvesting those resources in models of care that better meet the needs of people in our community today. The words leadership and support mean that we want to be of assistance beyond the grant check. Now, I know that none of you came here because you were interested in receiving money from us. It was only in this other way of helping you that you came. But we really believe sincerely that by sharing and learning together, we can move the needle in our community on some of our most pressing problems. The words improve and transform have historically characterized our grant making. We have made smaller, responsive grants to make incremental improvements in health and well-being, and we have invested in large, long-term transformational initiatives to really get at the root causes of some of our society's issues. Health and well-being continues to characterize our broad definition of health, And our commitment to individuals, families, and communities manifests itself very clearly in our new program strategy areas. So while our mission has not changed, we have made some significant changes in the ways we will be working with you. Clearly reflecting our mission, our new program strategy areas are listed boldly in the 3 green sections that are on the PowerPoint and also in your handout. Urban health and well-being, urban community revitalization, and urban families. As noted at the top of the graphic, we will continue to make the following types of grants within each portfolio. We will make discretionary grants, operating support, program support, capital support, and capacity building support as we have in the past. However, what we've learned from the grant making that we have done is that in order to be an outstanding nonprofit organization, you must have capacity certainly to, pay your bills and keep the lights on, but equally important are the 5 areas that are listed at the bottom of the graphic. We believe that organizations need to be very strong in collaboration, communication, leadership development, outcomes and learning, and policy and advocacy. And I will go into a little bit further detail on those areas in a few minutes. Our board and professional leadership have established a primary goal for St. Luke's Foundation of evolving as a learning organization. For us, a learning organization is measured by our ability to get better at getting better at achieving our outcomes. So for St. Luke's Foundation, our approach is designed to help us get better at getting better at improving and transforming health and well-being in our community. Our new goals for this approach are essentially twofold. We're seeking grantee partners to increase the community's capacity to address the complex, changing needs of our most vulnerable citizens, and we are addressing the root causes of disparities in health and well-being, including those that support policy change and promote equity. Our new grant-making philosophy and process tie our spending policy and our grants administration directly to mission-driven strategic criteria, with the goal of learning, both with and from our colleagues in the philanthropic and nonprofit sectors. The key changes that we will be making is that we will narrow the scope of our grant making and go deeper with community partners in the areas where we believe we have gained some traction and see potential for impact. This translates into a higher level of support for fewer organizations and the establishment and nurturance of relationships that reinforce learning together. We will shift from grant portfolios distinguished by size and scope. So historically, our short-term responsive community grants and long-term root cause-oriented transformational initiatives to 3 distinct program areas, as outlined in your handout and in the PowerPoint. We're also establishing new program strategy committees to help inform each of the 3 program areas, and they will be comprised of board members as well as a select few community experts in the areas of expertise. And their primary responsibility will be in helping us learn about what works to move the needle in those areas and also to set strategy. And then our grant making will be made to organizations and projects that have potential to advance that strategy. As I said, we will prioritize learning together, and we will focus on the 5 capacity building areas that I previously mentioned. We're also realigning our staff and board committees and our grant-making process to support these overall objectives. We've realigned our professional staff as well as our board committees, and I'm very pleased to announce, if you haven't already heard, that Latita Smith has been promoted to Vice President for Programs, Outcomes, and Learning. Yay. In this role, Latita will manage the program staff, including our senior program officers, grant manager, and program assistant. And may I take a moment to introduce or reintroduce our program staff, which consists of Sandy Chappelle, our senior program officer for urban community revitalization, Angel Johnson, our program assistant, and she will be the person you talk to when you call and want to talk to one of these people, and Bridget DeLeon, our not-so-new grant manager, who really hit the ground running and has helped us think about how we can make some of these changes really happen. At this point, it is my pleasure to introduce Doug Wang. Doug is the vice chair of our board and also chair of our investment committee, and he will discuss the board's role in all of this.
Thank you. Good afternoon, and thank you all for coming. In April of last year, our board and staff met in a retreat, and at the beginning of the retreat, our facilitator challenged us with this quote from the McKinsey Quarterly. The ability to pressure test strategy is especially timely now. The financial crisis of 2008 and the recession that followed made some strategies obsolete, revealed weaknesses in others, and forced many companies to confront choices and trade-offs they put off in boom years. All this makes today an ideal time to kick the tires on your strategy. And that's what we did. Our board and our staff looked at the literature and spoke with our colleagues, and we arrived at a new way of spending and a new way of working with our grantees, which we are sharing with you today. Our board also sent a clear message that we wanted to be even more engaged in the work of the foundation, and this led to the establishment of a program strategy committee for each of our 3 program strategy areas. These committees comprise board members as well as community experts in these strategy areas. Their primary responsibility will be to develop the strategy for each area and then measure the extent to which our grant making advances the strategies. They will also be helping to plan board meetings that are designed to increase the board's knowledge around what works in these areas, and we'll be changing the nature of our site visits to allow us to learn more from you who are doing the important work that advances our mission. And I can't emphasize that more, that we really are dependent on your input as well in making this work. Now, as far as spending policy, that was sort of a key part of all this. And what we recognize is over the past several years, our historical spending policy, which was based on market performance, has allowed us to make more grants when times were good and fewer when the economy was weak. And that really is sort of backwards with the way the needs work. As a result, our investment committee became deeply engaged in investigating alternative methods to calculate spending. And in a broad sense, we also challenged ourselves to rethink, redesign, and reinvent ourselves in terms of our spending. And we agreed that we wanted to move from a spending policy that was based on market performance to a new way of calculating spending that is based on our mission. So our new approach will provide a higher and more predictable level of support for our grantees, which I think would be well received, and will enable us to provide more resources to organizations that demonstrate effective outcomes in the near term. And we believe that this will also pay great dividends in the years to come. And as a result of our new policy, our board approved a budget increase to $12 million for this year. And just for some context, in the past couple of years, we were much closer to $10 million. So this represents a substantial increase.
So what does this all really mean? Is it a bunch of words? Is it a bunch of language? The answer is really no. It is fundamentally, we believe this will fundamentally change the way we interact with you. It will also fundamentally change the way we act with each other. And we think that that's great. So to go just a little bit deeper into the 3 program strategy areas, let me explain a little bit more about what we mean by each area. Urban health and well-being is a strategy that will catalyze opportunities to improve community health outcomes. There is some outstanding work being done in this community with the potential, we believe, to really move the needle on health outcomes, on the chronic diseases that disproportionately affect minority populations, and in our overall state of health. And so we want to get behind and support those programs in a very deep way. And we don't just mean physical health. By health, we certainly mean physical health, but we also mean behavioral, environmental, and oral health. We think that the health of the whole person is vitally important. We also don't just mean health care. We mean chronic disease management, and we mean prevention. And we are also very committed to the development of a highly skilled, culturally competent healthcare workforce. We all know that healthcare is the #1 employer in our community, and we want to make sure that underserved populations have an opportunity to participate in that economic opportunity. The Urban Community Revitalization Strategy, as I mentioned, will be managed by Sandy Chappelle. And we are very lucky to have Sandy in that role. I don't know whether you know this or not, but Sandy co-chairs the Cuyahoga County Place Matters team. And the concept of Place Matters, or where you live, work, and play and worship, the impact that that has on your health outcomes, has very much become a part of the fabric of St. Luke's Foundation, and largely with Sandy's influence. So, just as an aside, we have been sponsoring a Why Place Matters series at the City Club. It's a 4-part series. The first 2 sessions were last year. The next 2 are coming up. If you missed them, they are available on the City Club website, and I encourage you to attend the next 2, because we're really trying to advance the discussion in our community about why there are disparities, sometimes as many as 24 years in life expectancy for people who live in one zip code to another, maybe 5 or 6 miles away. We believe that that's a grave injustice, and it's something that we want to focus on going forward. Also included in this commitment to place is an ongoing commitment that St. Luke's Foundation has had to the 3 neighborhoods that were historically served by St. Luke's. The Buckeye-Larchmere community, Mount Pleasant, and the Woodland Hills communities were the neighborhoods not only that St. Luke's Hospital served, but also where many of our employees live and where our retirees continue to live. And so we do feel a special commitment and responsibility for those neighborhoods. We also want to support vibrant urban neighborhoods by addressing the various social determinants of health, those things that impact health, including neighborhood conditions, community development, safety, healthy eating, active living, access to fresh food, land use, and so forth. And a key component of this strategy area is a deep commitment to engage those who are most affected by the decisions in the decisions. There was a great publication that came out last year by our colleagues at Grantmakers for Effective Organizations called Do Nothing About Me Without Me. And too often we in philanthropy are guilty of making great plans for people without including them. And so our commitment to urban neighborhood revitalization is one that is deeply rooted in the concept of engaging the community in decisions that affect them most directly. And finally, our urban strategies, our urban family strategy. By urban families, we mean that we want to be supportive of the basic needs of people who live in urban communities. This is the least well-developed of our strategies because it's an area that's a little bit new for us. Latita will be managing this strategy area, and it includes such things as promoting family stability and resilience with targeted investments that address the basic needs that people need to live a healthy life. To go a little bit deeper into our types of grants, we will continue to make the types of grants that are reflected at the top of the graphic. General operating support is the unrestricted funding that we provide in support of an organization's programs and infrastructure. It's the most flexible, usually the hardest to obtain, and yet our grantee partners tell us that this is the most significant support that they can get. So we will continue to provide general operating support. Discretionary grants will continue to be made for small, time-sensitive, one-time emergency needs. We will continue to provide program support, and this is whether it's the development of a promising new idea or the administration of a program or an initiative within your organization. We will continue to provide capital support. That would be support for either equipment, bricks and mortar, or a capital campaign. We will continue to consider program-related investments. These are low interest, long-term loans or even equity positions that we might take in a project in a nonprofit organization. And we will provide capacity building support. As I mentioned, our capacity building support will be confined to the 5 areas that we believe are essential for nonprofits to be strong. And these would be focusing on collaboration, communication, outcomes and learning, public policy and advocacy, and leadership development. We also intend to make fewer, larger grants. That's the bad news. The good news is, well, it's kind of good news, but it's mixed. But the other good news is that we plan to reinstitute multi-year grants. We had suspended multi-year grants in 2008 in response to the volatility of the economy, and we know that that really puts an unpredictability to your organizations. But we didn't want to commit funds that we didn't know if we were going to have, and we were holding out hope that the economy would improve significantly after 2008. And since it hasn't, we've just thrown in the towel, changed our spending policy, and said, okay, we're going to reinstitute multi-year grants. And the major change is that instead of organizing our grants according to size and scope, we will evaluate grants on the extent to which the proposed work advances one or more of our new program strategies. A little bit more on the capacity building. In terms of outcomes and learning, we are very, very committed to tapping into the power of outcomes measurement as a way to support continuous learning and to encourage improvements in performance. It's a subtle but significant shift from measuring outcomes for accountability to measuring outcomes to help us learn. And we think that that's an important leap to make. We've also learned that collaboration is vital in our community. We have a nonprofit structure and sector that was built for over 1 million people. In the last census, we're hovering around 350,000. What that says is, it doesn't say that the needs have diminished, but it does say that the ability to support the infrastructure of a sector that was built for 1 million people just isn't there anymore. And so we will support efforts to collaborate, and we will be seeking opportunities to collaborate with our philanthropic partners as we go forward. With respect to communication, this is an area that we feel like we've really gained some traction. Our Make It Stick grants taught us that it's really important for us to support communication that is strategic and communication that enables an organization to tell its story by using its outcomes. And so this is an area where we will continue to provide capacity building support. We've also added public policy and advocacy to our list of areas in which we will provide capacity building support. We know that philanthropic support is important to you, but that the really significant funding comes from the government. And so we, insofar as it is possible for private foundations to do, will support efforts to educate policymakers and to influence smart public policy. And that is something that we're very excited about adding to our portfolio of capacity building. And finally, I mentioned leadership development. We have a strong belief that great leaders produce great results. And so we want to invest in the leadership of our community. And we also believe that organizations need to be thinking about the next generation of leaders and leadership that is contextual within your organization. You know, frontline employees are leaders too. And so we will be asking our nonprofit partners to think about your approach to leadership development, and perhaps we can provide some assistance with that. So we'll be talking to you about how your organization approaches these capacity building areas, and we will discuss the potential for funding opportunities that might help you build these kinds of capacities. So now it's my great pleasure to turn the microphone over to Latita, and she is going to share more about the changes that you can anticipate in our actual grant-making process.
Good afternoon. We have made several key changes to our grant-making process to help support our new approach. It's important for you to know, though, that we gave really careful consideration to every change that we made. We recognize that while we live and breathe this process on a daily basis, that for most of you, you interact with us once or twice a year, and so predictability is important to you. We also know, because we took some time through our planning to survey several of our grant-making colleagues, that grant-making processes vary widely in this community, and so we recognize that it's really important for you to be able to plan both your time and your energy. And so we hope that you know that with every change that we've considered, we've thought very clearly about how we could streamline our grant-making process for grant applicants, and also working really hard to make sure that our work is clear and predictable and practical for you. We also appreciate the additional time and effort that any changes take and will have on you, and it's for that reason that we moved our first quarter 2012 deadline from January 1, as it normally is, to February 1. Following that, we will have quarterly deadlines, and those dates are within the document at your places, and the deadlines for 2012 include February 1, April 1, July 1, and October 1. So the 5 primary changes that we've instituted. Number 1, we have eliminated our letter of inquiry. Instead of a 2-step grant-making process with an online letter of inquiry and then an online proposal following the site visit, we will now only have one online proposal that's due on those quarterly deadline dates. It was not an easy decision for us to make to give up the LOI. We were actually one of the first foundations in this community to introduce it. However, we recognize that often we were requesting information between the LOI and the proposal that were very much redundant. We also recognize that sometimes we'd have a site visit and then an organization would only have a week or 2 to complete the proposal. And that didn't seem like a good use of your time or ours. So now we will have this one opportunity for organizations to make a strong case to the foundation. Because we've eliminated the letter of inquiry, we are highly encouraging organizations to take advantage of our Get Acquainted meetings. We have always had these opportunities for organizations to come in and talk with us about potential projects before presenting them to the foundation. But now that the letter of inquiry is no longer available, we strongly encourage organizations to take advantage of this opportunity. Particularly during this time when the foundation is reframing its approach, it's very important that you have an opportunity to meet with the senior program officer who's dedicated to your particular program strategy area to determine if the project that you have in mind is going to be a strong fit for us. In the past, our grant making was largely responsive, and so therefore we were looking to fund a number of projects under each umbrella that fit our broad areas of interest. Now we're looking to become much more targeted, much more focused around our key outcome areas, and so it's no longer simply a matter of are you a fit, but is this the best use of the foundation's resources and the best way that we can advance the program strategies. We've also reformatted our online proposal. Because we want to make larger grants, because we want to make more multi-year grants, that requires that we have additional information. Also, because we want to develop deeper partnerships with our grantees, we want to know more about your organizational capacity. We want to understand what your current approach is to those areas that we value, like leadership development and collaboration, communication, policy, and advocacy. We also want to better understand the methodology behind your service delivery so it can help us to sharpen our program strategies. We have reformatted our site visits. In the past, our site visits, while fun, were often an hour or so conversation that was largely one-sided and usually consisted of either monologues or lengthy PowerPoints that our board and staff will come out to experience at your organizations. However, what we found is that, as we're looking to go deeper, and both Denise and Doug mentioned that we have a strong interest in really deepening the relationship that our staff has with your organizations, as well as a relationship that the board has. We want to be able to engage in much more meaningful conversations. So gone are the agendas and the PowerPoints, and instead we hope to have a dialogue with you about what's going on in your organization. What are the needs that you're seeing organizationally? What are the needs that your clients are presenting? And how can the foundation best partner with you both to move our mission and to meet your priorities as well? So we have significantly reformatted the site visit, and those site visit guidelines will also be available on our website. And then lastly, while we spent most of 2011 really working to reframe our grant-making approach, the work that still remains that we're conducting through most of 2012 will be to develop an outcomes and learning strategy that complements this new approach. You know that we love the logic model, and it's not going away. However, the logic model in the way that we currently use it does a great job of capturing the impact of individual organizations. What we need is to develop a system for really looking at portfolio level outcomes. So what are all of our urban health and well-being projects, or all of our community revitalization projects, or all of our families projects collectively yielding? And how is the foundation through these investments really looking to move the needle? And so we've engaged a national firm, the TCC Group, to assist us in developing an outcomes and learning framework that supports our new approach. They are going to assist us in developing individual logic models and theories of change for each program strategy, a larger strategy that works as an umbrella for the entire foundation, and then also assist us in developing how we need to be gathering data from you. Many of you will have an opportunity to work with them over the course of this year because they are very interested in working with our grantees to make sure that the outcome measures that we prioritize are practical and realistic and meaningful for you, because it's not just a matter of collecting data that's interesting to the foundation. This work will be occurring through the first 3 quarters of the year, and then when it's complete, we look forward to the opportunity to share that with you. We also hope that when we're done establishing this framework, that we will begin to have additional conversations with you regarding your own systems for performance measurement and how you incorporate the data that you collect into your own learning and practice. As Denise mentioned, the ultimate driver for our redesign was an unrelenting focus and passion for improving lives in Greater Cleveland. We know that these are commitments that we all share. And so we thank you very much for your time today, and we really look forward to beginning this work together.